Welcome back to the lecture series on removable partial dentures. In part 2, we have discussed about lingual bar. In this video, we will be discussing about the lingual plate.
Next is lingual plate mandibular major connector. Lingual plate is also known as a lingual plate. Lingual plate is indicated in cases where the lingual bar is not accommodated. Where the lingual bar cannot be accommodated, in that kind of cases, lingual plate can be indicated. Let us see the designing of the lingual plate first. Designing of the lingual plate is done on the diagnostic cast. This is a diagnostic cast. Designing is done on this cast. The first step in designing the lingual plate is marking the basal seat areas. The shaded portion here is the basal seat area. This is a basal seat area. So you have to mark these basal seat areas on the diagnostic cast first. What are basal seat areas? These are the portions of the gingiva which is coming in contact with the denture. So these areas are providing the stability to the denture. This is about the marking of the basal seat areas. Next step, you have to mark the inferior border of the denture. This is the inferior border of the denture which is marked on the diagnostic cast. After marking this, next you have to mark the superior border of the denture. This is the superior border of the denture. The superior border is extended onto the tooth surfaces. Let us see about this in detail. These are the incisor teeth. Incisors are divided into three portions: incisal third, middle third, and the cervical third. It is important that the superior border, it should follow the natural curvature of the tooth, and the superior border should not extend beyond the middle third. It should stop near the middle third of the incisor, and only in the interproximal area it is extending till the contact point. This is the contact point of the incisor. Only in the interproximal area the superior border is extended till the contact point in order to cover the interproximal spaces. This is about the superior border. After this step, you need to mark the rest seat areas on the canines and on the premolars. Lingual plate requires the rest seats in order to provide the stability and also for the positive support. So rest seat areas are marked on the canine and also on the premolars. After marking the rest seats on these teeth, rest seats are also marked on the posterior teeth here. So after all these steps, the last step is to mark the minor connectors on the diagnostic cast. These are the minor connectors. So these minor connectors are sketched for retention of the acrylic resin denture base. If there is any spacing present in between the anterior teeth, or if there is any gingival recession, in such cases, if lingual plate is given, there is a high possibility for the exposure of the metal in the interproximal areas. So in order to avoid this, if there is any anterior spacing, in that patients, if lingual plate is to be given, then lingual plate is modified and a cutback is given in the interproximal area so that the metal is not visible in the interproximal area. This kind of design is known as interrupted lingual plate. And when you look at the inferior border of the lingual plate, it is having a half pear shape which is similar to that of the lingual bar. So this design is similar. Inferior border design is similar to the lingual bar in order to maintain the rigidity and also in order to provide the strength to the lingual plate. Let us see where the lingual plate is commonly used. In which clinical situations it is used? It is used when there is high lingual frenum and also when the space between the gingiva and the floor of the mouth is less than 8 mm. In that cases, lingual plate is preferred because it allows the inferior border to be placed more superiorly without causing any irritation to the tongue and to the gingiva. And it is also indicated in the class 1 situations where there is significant amount of the vertical ridge resorption. And it is also indicated in weakened periodontal teeth. It is used like a splint to the weakened periodontal teeth. And it is also used in cases where there is inoperable mandibular tori. Inoperable mandibular tori. And what are the advantages of the lingual plate? Lingual plate is more rigid and it is providing the good support and also stabilization. And it is providing the indirect retention because it is having the rests on the premolars. It is providing the better patient comfort and the phonetics. What are the disadvantages of this lingual plate? There is a chance for the soft tissue irritation and also Extensive coverage of the teeth can cause the decalcification in future.
This is all about lingual plate mandibular major connectors. We will be discussing about other mandibular major connectors in the upcoming videos. If you found this video helpful, hit the bell icon below and subscribe to my channel. Thank you for watching.